Hey Savvy Social Workers, so in this video we are going to chat about some of the common psychotic disorders that you are likely to see on the ASWB exam. First, we're going to get started with one of the most common, which is schizophrenia. Schizophrenia is a serious mental disorder in which people interpret reality abnormally. It may result in some combination of hallucinations, delusions, and extremely disordered thinking and behavior that impairs their daily functioning, can be disabling, okay? So just to simplify that, they're going to be having these weird thoughts and hearing things, seeing things, and their thinking is going to be totally out of order. Like maybe somebody's after them or chasing them, and so it's going to disable their normal functioning. So here are the symptoms for schizophrenia: delusions, hallucinations, disorganized thinking or speech, extremely disorganized or abnormal motor behavior, catatonic behavior, or negative symptoms. And we know that negative symptoms refers to the reduced or lack of ability to function normally. So for diagnostic criteria, 2 or more of these symptoms have to be present for a portion of time during a 1-month period. So 2 of these symptoms for a 1-month period is what we're looking for. However, they also have to show continuous signs of the disturbance that persists for at least 6 months, okay? So this was kind of confusing, so just to clear it up, I'm going to repeat and stress it, that it has to have 2 or more of these symptoms for at least a month, okay? And so once we, find that they have 2 or more of these symptoms for a month, continuous signs of this disturbance has to persist for at least 6 months, okay? This 6-month period must include at least 1 month of full out symptoms. So y'all can pause on this screen and make sure you have a good understanding of this, because all the difference in splitting the time frames can be a little confusing. So if you need to pause and get a better understanding of exactly what this is saying, because that's what I had to do to be able to explain it, do just that. But understand that first and foremost, when we're looking at schizophrenia symptoms, we have those are the main ones right there, and you have to have 2 or more to begin with. That's going on for at least a month, okay? And then once these 2 are going on for at least a month, now we can pay attention to see if the signs are continuous, or if they persist for the next 6 months, for at least 6 months, okay? And so when we're looking for during this period, the 6-month period, it must include a full month of symptoms. It can't just be 2 or 3 days of symptoms and then it's nothing. It has to be for those 6 months. Within those 6 months, it has to be a full month of symptoms for us to officially diagnose a person with schizophrenia. So in the STEM, they are going to be asking you to assess or diagnose these symptoms. So primarily, I would tell you to know the symptoms. You also have to, of course, know the duration, but I've seen a lot of questions where they're giving you the symptoms and asking you to identify the symptoms in regards to how long they've been going on. So that brings me to the next disorder, which is schizophreniform disorder. It's a type of mental illness called a psychosis in which you cannot tell what is real from what is imagined. So we're going to get into understanding the difference between schizophrenia and schizophreniform disorder. So like schizophrenia, schizophreniform disorder is a psychotic disorder that affects how you act, how you think, how you relate to others, how you express your emotions, and how you perceive reality. But unlike schizophrenia, it lasts 1 to 6 months instead of the rest of your life. So with schizophrenia, you have all these same symptoms. However, they are lifelong. With schizophreniform, I tell people I like to think of it as a form of schizophrenia because it only lasts for a short period of time. The symptoms are very similar to schizophrenia. Delusions, hallucinations, disorganized speech, or strange behavior, and other symptoms, including limited emotional expression, lack of energy, poor hygiene and grooming, loss of interest or pleasure in life, withdrawal from family and friends and social activities. So in the other symptoms category, those are where the symptoms to me differ a little bit more from schizophrenia, because as you notice, the first four are almost exactly what schizophrenia looks like, but these other symptoms of the schizophreniform disorder, where they are lacking energy, having poor hygiene, that can be seen in schizophrenia as well, but that's just even more defining factor of schizophreniform. So just remember, schizophrenia is more long-term, and schizophreniform is actually a form of schizophrenia that's pretty much temporary. We look at it as pretty much temporary, lasting between 1 and 6 months. All right, let's look at schizoaffective disorder. This is marked by a combination of schizophrenia symptoms, such as hallucinations or delusions, and mood disorder symptoms, such as depression or mania. So we're also going to look into why or how schizoaffective disorder is different from schizophrenia, because all of these schizos, they kind of run, you know, along the lines of the same course for me when I'm thinking schizo. So it's very important for you to be able to understand the difference. And that's why I started with schizophrenia, because that's pretty much the main one. And all the rest of these are kind of like branches. I consider them to be branches of schizophrenia. So let's talk a little bit more about schizoaffective disorder and how it is different from schizophrenia. So schizoaffective disorder, to me, I have this affect in here highlighted because that is what distinguishes it. The affect is different. So you still have similar symptoms that that you will see in people that are diagnosed with schizophrenia, but the affect is different because there are two types, both of which include some symptoms of schizophrenia, but you have the bipolar type and the depressive type, which are affects. So that means that those are going to affect your mood, not just your mindset and not just, you know, the delusions and all that. It's also going to affect your mood. So the bipolar type, it includes episodes of mania and sometimes major depression. And of course, the depressive type, it includes only major depressive episodes. So as we notice in just regular schizophrenia, it doesn't really have these mood types. So whenever there are mood types involved, that's how you know it's schizoaffective disorder. Okay, so think about, when you think about affect, you know that's has to do with the mood. So we're talking about the bipolar type, the depressive type. So in a STEM for a question, if they are telling you, they're giving you these symptoms, and they're also telling you that the client you know, is delusional, having some odd and strange behaviors, and also struggling with major depression, then we know that is a candidate for schizoaffective disorder. The diagnostic criteria for a psychiatric disorder to be diagnosed as schizoaffective, it must be characterized by a bout of illness during which a significant mood episode is manifested. So that is the biggest difference, is when you are seeing these schizophrenia symptoms, a mood episode, whether it be bipolar type, so the mania, or the depression, it has to be manifested. Okay. Hallucinations and delusions must also be present in a time span of 2 weeks. So of course, that's where the schizophrenia symptoms come in at. And it's also important that drugs or medication are not the cause of these mood symptoms, hallucinations, or delusions. So if a person is on drugs, we can't just automatically diagnose them with schizoaffective disorder, or if they are having any other types of issues, or if they just have major depression or whatever. We can't do that. We have to make sure that it's all there, that they have had these hallucinations and delusions for at least 2 weeks, and then they have this major mood episode, whether that be the bipolar type or the depressive type. So the key difference between schizoaffective disorder and schizophrenia is the prominence of the mood disorder. With schizoaffective disorder, the mood disorder is front and center. So yes, we are having these schizophrenia symptoms, but more prevalent than anything, they are manic or they're extremely depressed along with these symptoms. That's how we're going to distinguish it. Now, I just threw this one in here for lagniappe because, y'all, when I was studying for the exam, just all the schizos, just like I said, ran along the same lines, and I had trouble knowing which was which. So schizoid personality disorder, I put this in here because it's not necessarily a psychotic disorder. I mean, I guess if you, depending on how you look at it, but it's not under this class. But because it's schizo in the front of it, I wanted to just make sure you're able to distinguish that as well, in case you've seen it on the exam, which is likely. So schizoid personality disorder is an uncommon condition in which people avoid social activities. So as you can see, it has nothing to do with the schizophrenia symptoms of, you know, hallucinations, delusions, or behavior. It is people avoiding social situations and consistently shying away from interaction with others. Totally different from any of schizophrenia symptoms. So I wanted to point that out. Schizoid, I look at it like a type of social anxiety. So if you can remember that, just remember that it has nothing to do with the other schizo prefaces, okay? They also have a limited range of emotional expression. That's pretty much all I'm going to say about that, because I'm probably going to do a series on personality disorders. But again, I just wanted to point out that schizoid personality disorder has nothing to do with schizophrenia, schizoaffective, or schizophreniform. All right, delusional disorder. It's one of the less common psychotic disorders in which patients have delusions, but not the other classical symptoms of schizophrenia. So that means they're just delusional, but they are not hallucinating. They don't have the mood disturbance or the flat affect. So this little image of the skeleton trying to fit into these pants, which, you know, shows he's delusional, but his mood is fine. He's not hallucinating. He's just delusional. So that's less common. I'm not sure how often it's on the exam, but I did put it on here because it is in this class, and I wanted you to know the difference if you've seen it. Now, last but not least, we are going to talk about brief psychotic disorder, and I kind of have a lot to say about brief psychotic disorder, okay? So this is a thought disorder in which a person will experience short-term, heavy on the short term, y'all, gross deficits in reality testing, manifested with at least one of the following symptoms, which are the same as the schizophrenia symptoms, okay? But it's very, very short term. So the delusions, hallucinations, disorganized speech, and the canatotic behavior. If you need an example of what those are, I have them listed. I have the definitions listed here, so you can pause and look at what delusions look like, what hallucinations look like, because in the stem of a question, they are going to give you, sometimes they'll just tell you, you know, the person is having hallucinations. They may not, you know, specify. So it's good to know the definition of them as well, but most of the time they'll say the person is experiencing some delusions or some catatonic behavior. It'll just say that specifically. So yes. Now, the diagnostic criteria for brief psychotic disorder is the sudden onset of psychotic behavior that lasts less than 1 month, followed by complete remission. That's the key, with possible future relapse. It is differentiated from schizophreniform disorder and schizophrenia by the duration. So as you notice, again, it has the same symptoms as schizophrenia and schizophreniform, but the difference here is the duration. It lasts less than 1 month. So judging by the name where it says brief psychotic disorder, just know that it's very short term, but it's still a psychotic disorder because it has the same psychotic symptoms as schizophrenia, schizophreniform. However, it's just brief. It's the brief version of it. So yeah, that's pretty much it. I hope I was able to simplify these for you. Watch this video as many times as you need to get this down into your spirit, but hopefully you are able to study this in a way that you are able to recognize in the stem whenever they are giving you these symptoms. Pay attention to these symptoms and pay attention to the duration of the symptoms, because you're going to have to know what to assess for if you're assessing for schizophrenia, or if you're assessing for brief psychotic disorder. You're going to know the difference is going to be in the duration, okay? If you're assessing for schizoaffective disorder, then you know that the difference is going to be in the mood. It's going to have some type of mania or some type of major depression with it, okay? And then if it's just your regular schizophrenia symptoms, they will look like these. Okay. Again, with schizophrenia, knowing the duration of these symptoms are very important. And also knowing that schizophreniform is a form of schizophrenia that only lasts 1 to 6 months. Of course, brief psychotic disorder is under a month, and then we have schizophreniform that lasts 1 to 6 months, and then it goes up to schizophrenia if it lasts longer than 6 months, and that usually lasts for the rest of your life. Leave me any questions or comments down below if you have them. Again, I appreciate you being here. Thank you all for your support. Please like this video, subscribe if you haven't, share the video with anyone that you feel this would be useful to. And again, let's continue to get those passes the savvy way.